check for his vitals. I would check both his radial pulses. They're there. We would just check if it's bounding, thready, normal strength, if they're irregular. And while I was checking his pulses, I'd also make sure he has a brachial pulse, which he would have because it's coming all the way to the radial pulses, and he has them. I also do a skin assessment, making sure that it's not diaphoretic, if it's not cyanotic pale, making sure that there's not too much moisture, also make sure that it's normal skin integrity, normal thickness. I would, on the top of the hand, I would check for skin trugger, make sure that there's normal elasticity, and then I would then go over and check the hands, and I would have him squeeze my hands, make sure that he has motor function. I would then squeeze one of his fingers and ask him which finger am I squeezing, so that again he can indicate that his neurological function is normal. I would then check his cap refill by pushing down on the nail and then releasing. It shouldn't take more than 2 seconds for it to refill. Push down, turns white, you let go, and it refills. And then I would also inspect the arm itself, make sure that there's no abrasions, bruising, lesions, any scarring, any moles, or any other sort of abnormalities. And then I would move on to the chest, or I would also palpate the lymph nodes on the axillary region, making sure that I can't palpate any lymph nodes. I would check both sides. Alright, there's no lymph nodes to be palpated. And then I would come over to the chest region. I would make sure that it's symmetrical and not asymmetric. I would see if there's any barrel chesting or concave chesting. Also just see if there's any sternal protrusion. I would then palpate the chest to make sure that the ribs are intact. Also noticing if there's adequate rise and fall so that his breathing is appropriate. Also I'm asking him if he has any pain while he breathes. And then after palpating the chest, I would then want to listen to his his lungs. Normal respiratory rate is between 12 and 20. So I would then auscultate. I'm not going to put these in so I can hear myself speak. I would auscultate from the clavicle, pinching the clavicle, making sure there's normal trigger. Second intercostal space on the right hand side. I would listen to the bronchiovesicular sounds going in, checking if there's any wheezing or any crackles. It should just be clear, equal, and bilateral for both sides of the lungs. I hear nothing. On the left-hand side, second intercostal space, I should hear the aortic valve. It should be crisp. There shouldn't be any swishing, which would indicate a murmur. I would go laterally to the right. The aortic is on the right side, second intercostal. So I'll go laterally to the left side, second intercostal, listen to the pulmonic valve, making sure that it's also clear and it's also crisp and not no swishing. As I'm going down the chest, I would be going 1, 2, 3, 4, 5, 6, making sure that I am staying parallel with each time I go down the chest. So I'm listening to each side at the same time. And as for the lungs, when I start getting to the lower portion of it, I'm listening for any rales, any rhonchi, any signs of pneumonia. It's clear and bilateral. And then as I come to the fifth intercostal space, I should fifth intercostal space, mid-clavicular, I should be hearing the tricuspid valve. And if I go over towards the apex of the heart, where I can feel the apical pulse, I should be able to hear the mitral valve as well. And again, we're indicating that there is a crisp sound. There's no swishing that would indicate a murmur. And then I would come over to the axillary side to make sure that I'm hearing the vesicular parts of the lungs. And then I would repeat the process on the back. Also, while I'm looking at the chest, making sure there's no abrasions, any bruising, lesions, cuts, bleeding. I would also make sure that there's not a really strong pulsation in the middle or a bump that has a pulsation to it, because that could indicate like an aneurysm of the aortic vein or the aortic artery. And then I would sit him up, and I would listen to the back side of his body. I would make sure I'm not going over the scalp, scapulas, and I would go down from the C7, making sure that I'm not over the spine or over the scapulas. I would listen for the bronchial vesicular sounds, going from 1, 2, 3, 4, 5, 6, making sure that I am making sure I'm listening to both sides evenly, and then start coming around to hear the axillary sides of the lungs, making sure they're clear, equal, and bilateral. And then after that, I'd be checking the back, making sure that he has no pressure ulcers, making sure that checking the skin integrity, make sure there's no bruising, cuts, bleeding, or any of the other above. I would lay him back down, and then coming back to the chest. You can pause for a second.